All right, so you've gotten through the application, you've recorded the information on the consumer in the step 5 section, and now we're going to go ahead into step 6, which concerns plan selection. You can see how that looks on the tracking sheet and then how it looks on the resource page and the various resources we have available to assist you and the consumer with that plan selection piece. So first and foremost, you're in the eligibility results screen. What you're going to do is open that letter and then you're going to go into the Enroll Checklist, which looks like this. So the Enroll Checklist will kick you to do different tasks on separate screens, and once you've completed those, it will kick you back to this screen. So first and foremost, the consumer has to make a decision about how much of their tax credit they want to use. CMS really emphasizes that they can use some or none, but for the most part, our consumers use all of their credit. And the reason is we're very careful about the income estimate, and the credit is based on the income. Our suggestion, we believe the better way to deal with this is to change the income and thus the credit where applicable, and not to make sort of random decisions about using less, because how that works can be confusing because it changes in theory what the consumer is receiving, and it's not based on anything the way the full amount would be based specifically on the income we used on the application. So for the most part, we explain to consumers you're eligible for a monthly credit. Most people need the whole amount to afford insurance. Would you like to use that? And I would say pretty much everyone says yes, and no one usually has questions. Obviously, they can adjust the amount, but there's no real advantage to that. It just means they'll use less and they'll pay more. And then in theory, they could, of course, use none and then pay full price. But most of the consumers we're working with could not take advantage of that option. They wouldn't be able to afford it. The next question is going to ask whether or not the consumer is a tobacco user. Be very literal about this. If they smoke cigarettes that contain tobacco, if they vape a tobacco product, if they use chewing tobacco, they are considered to be a tobacco user. And the regularly refers to within the past 6 months, 4 or more times per week, excluding religious or ceremonial uses. You can give them that, but you usually don't have to. A simple, are you a tobacco user? Yes or no will suffice. If they answer yes, the last time they used tobacco will be asked, and I think most tobacco users will say today. Remember as well that there is a question on the tracking sheet about tobacco use, so you may already know this going in, and of course if you didn't manage to capture it there, please capture it there if the consumer lets you know they're a tobacco user at this step. You will at this point be able to see which consumers are being automatically grouped together in terms of plan selection. Now you can change this if you wish. If, for example, Richard was going to be a high user and Jessica said, I just want the cheapest plan that gets me out of being fined and protects me in an emergency, you could actually separate the groups out at this point. It is not usual. Consumers tend to want to be on the same plan together as much as they are able. But if a consumer would like to do that, I think it's more important to remember that is a possibility and ask someone to remind you where. But this is the screen where you can do that. There are a couple of screens that seem very helpful. Like here, for example, you can enter doctors, facilities, and prescriptions to see if they're in network by each plan. I will advise that this overarching marketplace tool is not very useful, and you can see below why. So if you list more than one doctor, it's going to let you know next to each plan that one of the two is covered. Now that doesn't help you because it doesn't let you know which. And if you were looking at medications, it's going to give you a yes or no as to whether the plan covers that medication in the formulary. It's not going to account for generics or brands or what the cost is. It's going to give a yes or no answer to a much more complex question. So I would advise not expending any energy entering information into this tool unless there's just one doctor you need to consider or just one specific type of medication that you need to consider. It tends to be better to look in each company's individual formulary and provider directory. So I would skip this. This also enables you to select whether the consumer expects they will use a high, medium, or low percentage of their coverage care. This doesn't make a lot of sense to most people, and it shouldn't, because obviously these are very, very subjective qualifications. So you can certainly pick a level, but I wouldn't expand any energy explaining to a consumer what the distinction is between low, medium, and high use, because of course that's very personal to each person. You'll notice too that these definitions are not terrible, but deductible, for example, is not defined correctly. Be aware we have definitions of all insurance terms on the website that you can use and you can print out for consumers as well. So the application will walk you through some of the different features you can utilize to look at plans. You probably will need to look at this once and that's it. If you are eligible for additional savings in a silver plan, it will indicate this here. If the consumer is not, it will just list out the bronze, silver, gold as categories. You want to just keep clicking next. It gives you the option to look at silver plans and if the consumer is eligible for cost sharing, or to look at simple choice plans. Now this is the one place where green is not your friend, although if you accidentally look at simple choice plans only, it'll show you a very few plans that it thinks are comparable for whatever reason, but that's an easy thing to get out of. So I would recommend clicking either See All Silver Plans or See All Plans. This will give you the list of the different plans options. That 38 plans I don't think is correct. I think it's more like 33 plans available from 4 different companies, which is what I tell the consumer, that they can pick between however many plans are listed for them, provided by 4 different companies. The plans are in order of the monthly premium, and really the biggest difference between the 4 companies is where in Austin, but also where outside of Austin you can use those plans. So, to explain to them how the plans match up with each other and how they're laid out through the marketplace, I start by letting the consumer know what each element of the plan layout is. So I start with a monthly premium. I always pick the least expensive silver plan on offer to explain this. And that last year in 2017 was Sendero Ideal Care. It's going to be Oscar plans for 2018. But again, this training was set up with the 2017 plans. So I would start by explaining that the full cost of this plan is $277.69, but after the consumer's tax credit, they would be responsible for a monthly premium of $72.69. I would then explain that the deductible is what they are responsible for before the insurance kicks on, as it were, and starts paying, except for services covered by a copay, and I'll explain more about that in just a second. Everything except monthly premiums and costs for non-covered services count towards the out-of-pocket max. If you reach the out-of-pocket max, your in-network costs will be covered by the health insurance company, except for the monthly premium. You'd have to keep paying the monthly premium to maintain your coverage. The out-of-pocket max is what I tend to describe as the worst-case scenario number. So all other things being equal, let's say you have a very high usage year, an emergency, an accident, this is the max liability for the cost of care for the consumer, assuming they stay in network and avail themselves of covered services. This plan has copays. It offers copays to visit a primary care physician, a specialist, and for generic medications. A copay listed here does not mean you first have to meet the deductible. So from day one, those 3 services are covered at a set copay. You'll notice above that, there's a copay listed for emergency room care after the deductible. So if a copay is subject to the deductible, it will usually be specified. You always want to check the summary of benefits to know exactly when that's the case. And the consumer should also be aware, because this is an HMO plan, they will need a referral from an in-network primary care provider or from the plan's nurses line to access services through a specialty physician. It's also good to be aware of the quick view option, which will give you the option to look at the summary of benefits in the provider directory and the list of covered drugs. For a lot of consumer, the education that I just gave will be sufficient, but if they have questions about the fine print of the plan, you can find that in the quick view section. So the provider directory is really the only place you should be checking to see if doctors are in network. Calling the office of a physician tends to be very limited in terms of how helpful it is. We do not recommend that. We recommend calling the provider directory. Typically the person manning the phones at the doctor's office does not know much about what plans are in network, and that's very important for consumers to understand. Be aware, of course, that directors each have their own kinks. As you can see looking below, there is the Sendero Ideal Care Provider Directory, and you're noticing there are different tabs depending on what search you're trying to do. So if I'm trying to look up a primary specialty doctor, I want to use the doctor tab. But if I was using that to look up a hospital, it would not function correctly. You'll notice there's a separate hospital search tab, as well as a separate auxiliary search tab and find a behavioral care provider. So these are not magical directories. They're not going to think through for you what you're trying to find. So there are some quirks to the navigation of these, but definitely grab one of us if you have questions about it, if you're trying a search that doesn't pull up anything. Now, the summary of benefits will provide you with a lot of the same information you've already provided the consumer, but it will also give you more detail. So another thing the Affordable Care Act did was it standardized the look of summary of benefits. So pretty much the first page in any summary of benefits will look the same. You'll notice things included here such as the deductible, the out-of-pocket max, the fact that there's no overall annual limit on what a plan pays. This is something done away with by the Affordable Care Act, what's called lifetime maxes or annual maxes. You'll notice too this plan does use a network of providers and that you need a referral to see a specialist. The second page of the summary of benefits will contain the cost of visits to the primary, the specialist, what it costs to have a test, and the different costs of medications depending on how they are tiered. And you would want to cross-check that against the the formulary. Page 3 of the summary of benefits will go into detail in terms of hospital, emergency, planned inpatient or outpatient surgeries. Again, if this is going to happen to the consumer, they should probably expect that they will meet the plan's deductible and out-of-pocket max because of the high cost of health care for those items. But this details the breakdown of what those potential situations or planned situations cost. Below that goes into the cost of mental health and behavioral health services, and you get a little bit in terms of prenatal and postnatal care information, which goes over onto page 4 of the summary of benefits, which talks about the cost of delivery in terms of a pregnancy benefit. Below that is a section on different types of rehabilitative care. Those can have limits, so a consumer interested in signing up for a plan needs to double check if they're going to expect to have any rehabilitative visits, whether there are visit limits in place, and they need to abide by that because the plan is only required to cover that number of visits. And those are pretty standard. There's also a section that talks about durable medical equipment. Things like wheelchairs or crutches or an oxygen tank all fall into the category of durable medical equipment. The ACA has also required that children have their vision and their dental services covered, and that is outlined here, what the cost of those pediatric visits connected to dental and vision are. Most of these plans do not offer those benefits for adults. That's something they can add on if they wish, but for the most part, our assistance is going to be limited to medical benefits and medical health care. On page 5, you will note certain services that are not covered, and these are pretty standardized. The state, essentially the Texas Department of Insurance, determines what services are required to be covered, and Texas does not require services such as acupuncture, cosmetic surgery, foot care, and infidelity treatment to be covered, and you'll notice that that's standard across the board. You're probably not going to find those services covered in any plan through the marketplace. You'll notice that this plan does list infertility treatment as a covered service, but goes on to state that treatment is not covered. Again, pretty standard. There are some numbers listed below for grievances and appeals. And this plan does offer Spanish assistance. This next page, page 7, goes into some examples of how much things cost, and all plans use having a baby and managing type 2 diabetes. What's vexing about this is this is not a cost estimator box shows, these don't have any real connection to reality. You should never show a consumer these and say, oh, you're pregnant and having a baby? Expect to pay $1,600. I've played with these and tried to make the math work, and it just doesn't work. And this next page actually goes into detail about the fact that none of these really can be used to predict a person's costs which begs the question, what are they for? And I have no answer on that, unfortunately. Suffice it to say that pages 7 and 8 of the summary of benefits are not useful, and I don't recommend utilizing them to explain anything to consumers.